ladies and gentlemen, I speak to the man who transformed Indian private healthcare system. He is the founder chairman of Apollo Hospitals, Dr. Prathap C. Reddy. At 93, Dr. Reddy is still dreaming bigger. His latest promise, Apollo never sleeps. Healthcare cannot take a Sunday off. His larger ambition, can India become the world's healer? Listen in to Dr. Prathap Reddy, the doyen of private healthcare in India. It's a pleasure to have you with us, Dr. Pratap Reddy. I think
Navika.
I'm blessed to sit across somebody who's pioneered private healthcare in India since 1983. That's a long journey, Dr. Reddy. Your network has 71 hospitals, you have 6,000 pharmacies, 2,000 touch points.
pharmacies. Every day two pharmacies are new pharmacies.
So
are
my
coming
numbers
up.
are dated.
Today it's almost 7,000, 8,000 pharmacies.
Okay.
8,000. They're putting up 2 new pharmacies every day. That's the team.
That's the team. And
the action is that you must be able to get for anybody within 1 hour's time there must be a pharmacy. So in India to go to the to the remote areas and the villages, not easy.
And now you're expanding this even more. You're saying that, Apollo never sleeps, always here. Sundays are going to be, fully working Apollo hospitals. What drives this, Mr. Pratap Reddy, at 93, to be able to push this and have 4 daughters who are absolutely so energetically part of your team driving this? What is the value system that you've given your daughters and your team?
My daughters, I owe it to my wife. I think it's her thing. She made them what they are today.
And not the father? Maybe they grew up...
Father made them work and they loved it, and they saw what father saw, the happiness in people's face, and that gave them the energy. And today they are outstanding things. I'm able to do all of this and much more we're going to do because the 3rd generation is also coming up.
Yes.
So I think this is just the beginning of being on the world-class care for our nation and giving it to the world. But you will see many, many more things happening. In healthcare, it's not the numbers, it's the outcomes. The outcomes are better than the best center anywhere in the world. And over 99% outcome. And costs. That was the reason when I started, no? I started because I used to leave patients because they can't afford to go abroad. The cost that time was $50,000. I started the heart surgery for $30,000. So everything across, we put stents. Stent is $100,000 in US. In here we put it for $6,000-7,000. Out of that, cost of the stent itself is over $3,000-4,000. Materials is $3,000-4,000. Hospital and doctor's charge is only 2 lakhs of rupees. So this is what we kept it saying. We must be able to, so that more and more people can afford to the
access to healthcare.
The best healthcare, no second best. I don't believe that because you're an Indian, you don't deserve that. We are global citizens, and we must have the very best.
Well said.
Now we think we'll not only give it to our people, we'll give it to the world. We're ready to give it to the world.
Because you're a man who has a vision, a man who thinks big, dreams big, and then achieves it. What is the one mission that you still feel you need to achieve?
I think we have put the seed, the tree has, banyan tree has come. I think we need to continue it because, banyan tree gives so many branches. So it will have so many other branches. So this is where, as I said, we'll continue to do whatever that is necessary to treat people sick. But our concentration is going to become on preventive medicine. You know why? Way back in the last decade, the World Bank, WHO declared that the world will face with a huge crisis in this decade with what's called the non-communicable disease. What are these non-communicable diseases? Heart attack, strokes, cancer, diabetes, infection. Now we added two more, obesity and mental illness. This 80% at the end of the day, thing will be people will die from non-communicable disease. Already 2/3 of the deaths are from non-communicable disease. But every one of them is preventable. I'm going to concentrate is on preventive medicine. You know, way back in 1973, I started what's called the mass health checkup and find out that there were risk factors like BP, sugars and all that. I said to control them so that their heart problems won't aggravate and all of this. I gradually took it, then I made it Apollo Health Checkup. Today, I've made it as what I call the Apollo Pro Health Zen. You must have that Zen. It gives you a complete...
The annual health checkups that can prevent.
Complete record of yours, including a whole body MRI, all the parts and about 100 tests. So whatever we find out, we know that this is thing. If you neglect it, you'll get a heart attack. If you neglect it, you can detect cancers earlier by screening. You can detect many problems earlier enough, so we can prevent. I took up with the Prime Minister a couple of years ago, saying that India is now ready to become a global healthcare destination. It is not just 70, 80 Apollo hospitals. There are another 200 good hospitals in the country who are already treating people from abroad and giving the best possible care for our country. I think we must develop, but people don't know. Even Indians in US, when they come here, when they have that problem, and my God, we can never get this in US. So I think if they make it, if the government of India can bring that awareness for people that Indian healthcare is this, it will be a huge thing for the world to be benefited from this.
And for India to become
the destination. And for India become number one.
Healthcare destination.
It's a huge industry. It's about a couple of 100 billion industry. Even if you get 20, 30 billion, it's foreign exchange income. More than anything, it's a prestige that you created an American here and you're treating a British person, a European person, an African person. That happiness the nation should have. The second thing I gave him more, that India, by the end of this decade, the world needs 8 million people, doctors, nurses, paramedics, and all of this. He acted immediately. Wonderful thing is, he saw us with my 4 C-Shaktis. And my wife said, why shouldn't I come? So Raji called and he said, I'll definitely come. So he did speak to me business for 25 minutes. First he said, I like your proposal, everything, but I want to rename it as Heal in India, because way back in 750 BC, Susrata made the first medical diagnostic and treatment. And people came to India till 1250 AD. So I want to call it Heal in India. Then when about the global healthcare destination, he said, I want to call it as Heal by India. That is, Heal by India is, they acted immediately. All ministries got the note. They opened 49 new medical colleges previous year. This year, 11 new medical colleges, 100 new nursing colleges, all other technology colleges. Nursing college, they made admission from 70 to 300. So we'll have additional 75,000 people. And we have now got 300 medical colleges. Nowhere. So it's good for us because first we need more people.
Correct.
Like we need more hospital beds. So we need to develop more hospitals. We need more healthcare people for ourselves. So out of these people whom we train, a couple of million people a year whom we train, we will use 10% of them. 80% of them will go abroad. First, for them, it's good because,
fantastic concept of Heal in India and then Heal by India.
Heal by India. I must tell you
Amazing.
another wonderful thing. I have a young daughter. Each daughter, I told you, they are all very special. Preeta does something else. Sunita looks after finance and everything, and manages as MD. Shomna, that's the one who did the 24/7, who made a big difference in
Pharmacies.
when we had COVID.
Yes.
20 million people could call 24/7. He'll connect to our doctor. Our doctor will listen to the patient's symptoms and say, yes, I think it's probably COVID. I'll send a diagnostic person to your house. He'll take the test. He'll take the test and then tell, yes, you got COVID, we go to the hospital. Then we found our hospital, we opened 300-bed hospital for COVID. We found that was not enough. Then we took 5,000 hotel beds. So the doctor will determine the symptoms are not serious enough to go to hospital. You go to the
yes,
hotel.
Those were trying times.
We have a nurse and a home care person. Doctor will come online.
Correct.
And 95% came work from there. They didn't go. They did not go to hospital. So like that, I think there are many, many things. So as I was telling this daughter of mine, she now is tying up with some hospitals in US and other countries. So we manage their care from here. So heal the world from India.
Absolutely.
Heal India, heal by India, by the Prime Minister. I compliment him for that. And now all ministries, just now also I'm going to meet the ministries on Monday. What each of these ministries can do to take that Heal India program abroad.
Well, as they say, there's one man who's the beacon in healthcare, and he doesn't sleep. And healthcare round the clock is the mission that he carries. Mr. Prathap Reddy, Dr. Prathap Reddy, it's an honor to sit across you and speak with you.